Right, so teenage pregnancy is once again in the spotlight as it remains one of the major concerns of school disruption. The Free State Department of Health, in collaboration with the Soul City and Lovelife, are launching a family planning program for learners in Bloemfontein. Well, the department says the launch is in response to pregnancies amongst children at the age of 10 to 18. The initiative aims to provide learners from 6 schools in that area with long-lasting contraceptive implants designed to prevent unintended pregnancies and to support the completion of their education. The program will address the pressing issue of teenage pregnancy, which possesses significant health risks, including severe complications such as death and cervical cancer. SABC News reporter Kamogelo Seekoei is live to us from there. Kamogelo, I think there's such an important conversation that needs to be had here, because if we look at what this intro says, it talks about the department saying that the launch is in response to the pregnancies amongst children aged 10 and 18. So there is no way that a child at 10, at 11, at 12 is going to consent. This is rape, but there are many challenges that we're seeing in our communities where some households would want to, hide what would be seen as an embarrassment and not speak about it as rape if you find the pregnancy of a child so young, and many issues, I guess, that need to be addressed by that very important forum that you are part of today as a reporter, of course.
Well, Criselda, indeed, as you are mentioning there are very many social issues that surround this matter of teenage pregnancy. In fact, in the province, the Department of Health is calling it child and teenage pregnancy because, as you've rightly mentioned, children at the age of 10, what kind of consent are they having? You know, these are some of the topics that the department is actually having. As we speak now, they have broken out in. They have taken these young learners who happen to be girls and boys who are present here into these different groups that are being addressed by different sectors, including the South African Police Service, Lovelife, as well as Childline. Of course, the Department of Health spearheading this. But Criselda, I just want to bring you into some of the statistics that we received from the department this morning. They've categorized these young girls who are falling pregnant into 2 categories, with the ages of 10 to 14 years, as well as 15 to 19 years. And in the category of 10 to 14 years, we see that in the year 2024, which is from the beginning of 2024 to December 2024, 108 young girls delivered babies. There's also 49 of them that were recorded to have terminated their pregnancies. And then in the category of 15 to 19 years old, that number goes really high. It goes to 5,049 of those girls who have delivered babies, and the number of them who have terminated those pregnancies went to 997. So the huge task that the Department of Health as well as the Department of Education have in terms of making sure that these young girls remain healthy, they do not fall pregnant, they remain in school. But I just want to bring in at this point the spokesperson for the Department of Health in the province, Mondli Mvambi, just to talk to us about this program. Today we see that a lot of young girls and young boys are here. We know that the department is spearheading this contraceptive program. Just talk to us a little bit about that.
Well, the importance of this program is MECs of the Free State provincial governments believe that the true measure of a society is in how it takes care of these most vulnerable people, and the children are part of that. And as early as February this year, we believed that there's a scourge of a child and teenage pregnancy is just too getting out of hand, and it needs to be kept, and therefore practical things needs to be done to protect the vulnerable children by making sure that we we put practical measures that will stop children from getting pregnant unnecessarily, and therefore being disturbed from attaining their life goals and completing school. So we took a decision as the provincial government that let there be campaigns like this, war rooms throughout the province, to make sure that you identify those that are vulnerable, and you put in place intervention measures that will help us keep the scourge. So we are here today to make sure that after getting the consent from the parents, the children, that some of them are vulnerable, they do get the prevention measures, and those that are already engaging in sexual activities, they also, you don't deny them, because as parents you are not with them all the time. As teachers you can't be guarding the children all the time. So make sure that there are practical measures that will make sure that you keep the scourge by implementing these long-term prevention methods.
Talk to us about some of the discussions that you are having with the young children today.
Well, the discussions are, we want to hear what the children are saying about their lives. What do they do when they are in their own safe spaces? How do they influence each other? What influences them? What are the other societal pressures that they are going through that lead them to end up engaging in early unprotected sexual activities? What do they know about sex? What do they know about the sexually transmitted diseases, illnesses? What are their future aspirations, and what is it that as government we can do to further their dreams and make sure that we nurture and protect and guide their growth path?
I see that there's also a sign there. It's called Youth Zone. Do you mind talking to us a little bit about the Youth Zone? I understand that it's an initiative by the department.
Yes. Youth zones are dedicated times in our clinics where children and peers and their peers, but guided by health workers, discuss matters of life, including sex. Because we realize that in health facilities sometimes there's an allegation, and in some instances it's true, where children walk into health facilities, but they meet that older nurse who is not friendly at all for them to can open up and talk about their lives, whether they are raped, whether they want prevention, whether they want advice, or they are promoting health-seeking behaviors. So those youth zones are those spaces that take out the prohibitive interactive mechanisms to can enable children to speak freely and get the proper advice, not get it from the internet, because even in the internet there are disinformation, misinformation and malinformation there. You can end up getting the wrong information. So it's better if you get it from the trained health experts. So youth zones are intended to do that.
We see in the statistics that children as young as 10 years are falling pregnant and they're delivering babies. When they come to the youth zones, do they talk about how their pregnancies came about? There's a huge concern about the fact that they are at an age where they cannot consent, and in most cases we find that the people who have actually fathered these children are much older than them. Do they disclose how they became pregnant? Is it rape in most cases? What is the situation?
Well, they do disclose, because children at some point will talk about their experiences. But unfortunately, this has been a nightmare for the Department of Health, because although we are at the tail end of dealing with now very young children as early as 10 giving birth, there's nothing we can do to stop it at that moment. But we do hear horrible stories about how breadwinners in the family, uncles, older people in society, and some instances respectable people are the force behind, the negative force behind these unexpected child giving practices. The sad part is that because of the socio-economic landscapes that are unequal, the perpetrators are not brought to book because families feel that, you know, that breadwinner, that respectable member of society cannot be put to shame by disclosing that they have impregnated a child as early as 10, you know, to 14, even in the category of 15 to 19, because even in that age, you are robbing a young child who's not yet ready to be a mother. You are robbing them of their future to become, you know, a parent at a you know, chosen time. So we are taking heed of some of the things that are said in those youth zones, and at an appropriate time we're using them, because the decision of the provincial government is that go after those who are violators of you know, statutory by statutory rape, because a child between 10 and 14 cannot consent to sex even with their own peers. So we are putting measures in place to make sure that we put the right values, the right morality in society, and make sure that society becomes what it ought to be. Yes.
Thank you so much for your time, Griselda. That was Mondli Mvambi there, the spokesperson for the Department of Health in the province. I just want to bring in a health expert, Nolikula Mashinini, who is actually focused on working with young people and schools across the province on this particular issue of teenage pregnancy. Just talk to us about what happens to a young girl when she falls pregnant. I think a lot of us would not understand that kind of dynamic. We understand teenage pregnancy, we see it, we see the numbers going up, but we don't actually get to grasp what happens to that young girl.
Okay, thank you so much. When you look at the young girl who fall pregnant, in terms of the education, they have the high chances of dropping out of the school, meaning that in terms of advancing or getting a proper career, they are not able. And then in terms of the society, they are rejected. Remember that this young child is being classified as a naughty child. Now it's rejected by the peers, as well as the parents, as well as the society, because of every parent wants to see the children going through education. Now if they fall pregnant, they reject them. They also suffer from the depression, because we don't know the root cause of the pregnancy. Some were raped, suffering from the statutory rape. Now they have to suffer through this because of it was not reported. And then when you look at this thing of the pressure that they are getting from everyone, it is a problem. They also have the health risk problems. Some of them, because of their body is not yet matured to carry the baby. When they are going to deliver, they might die, or the baby. Now it's a problem. And then because we know that when we are falling pregnant, we are engaging into unprotected sexual intercourse, meaning they have the chances of contracting the viruses such as the HIV, such as STI, meaning that they have a problem. They have a problem. Remember, it's still a child. Postpartum depression. When you have a child, you are not yet matured to handle your baby or to raise that child, because yourself, you are still a child. So now they are suffering from the postpartum depression, meaning that they also have the ideation of wanting to kill themselves because of this thing, because they are not yet matured.
Now, today we see that the department has come out, under this program to give young girls, of course, those who have been given consent, to get contraceptives. Can you just talk to us about the type of contraceptives that they are going to get?
Okay. Today we actually promoting a long-acting contraceptives, because it is very important to know that we want them to finish or to complete their medication or their matric so that they can go to the universities. So remember, when you have the long-acting contraceptives such as an implanon, that implanon is inserted on your arm. It is for 3 years. For the whole 3 years, you are not going to fall pregnant. However, we also promote the dual protection. We say that even if you have the implanon, use the protection such as a condom, because we don't want you to contract the virus such as HIV, STI. So we also promote that. We have the injectable contraceptives. The injectable contraceptives, we have the 8 months and the 4 months, which is the Depo and the Nerestrate. However, Today we are promoting the long-acting because we're giving them the information on that. We also have the tablets they are using as a contraceptive. With this one, it's a challenge. Remember that you need to stick to your time. You need to stick every day. You must take the tablet. Sometimes you are busy, you even preoccupied because yourself you have so many things. The schoolwork you forget. So if we promote the long-acting contraceptives, meaning for the whole 3 years, you are not going to fall pregnant. You are going to be able to complete your matric until as you go to the your universities. The other thing that we are doing today that I want to emphasize, as much as we are promoting the contraceptives, we have the grade 7. Remember that we are not yet implementing the services in the primary schools. We are doing the health education empowerment because we want them to know the behavioral changes. It's very critical. We don't just provide the services for everyone. We also promote the behavior. We call the healthy lifestyle. It's very important to enforce because some of them, they start their menstrual period without knowing what is it, because CSE, they are not doing it in data, or they are doing it but they didn't understand. So now, should you fail to prevent or to abstain, we say, come, let's insert you the implant. So we have in numbers distributed the consent form to 600 learners in 5 different schools here in Bloemfontein. They are here. We want to encourage them so that they can finish their matric and go to the tertiary or the universities and have a proper career.
So you mentioned that there are also grade 7s which are not part of the contraceptive program. But for those high school learners who are here, are they all signed up to get contraceptives, or is just a small group of them?
We have, I think, 80% of the learners who consent to be given the contraceptives. For these ones that didn't consent, not everyone is sexually active, remember? So now we cannot judge them. We give them, we say that if you are not sexually active, let not pressure kick you in. Remain not sexually active, abstain up until you are ready and you are married to engage into sexual intercourse. So for this one that consent for the contraceptives, we are providing the services to them. And you also have the VMMC, voluntary medical male circumcision, for the boy child, because we are not only concentrating on a girl child. We are also providing many services here. They also consent to receive the services that are here. And we also say that, remember, when they are sexually active, they might be indulging into unprotected sexual intercourse. We are also promoting the PrEP here for both boys and girls, and we also encourage them to test for HIV testing. So those one who want the contraceptives, we have the mobiles here that are inserting the implant on, and then we have the mobiles that are giving them the information. We have the dialogues that is continuing. For those one who are here just for the information, we are empowering them because knowledge is very, very important. Education is very important for our learners, so that at least we equip them with the accurate information, because nowadays we see that they get most of the information into the social media, and then they get the information from their peers. They don't, as a parents, we hardly communicate with our children, which is a problem, because now we tell them that if you do this, you will fall pregnant. We don't talk topic as it is. We need to make sure that we talk everything as it is.
Let's just close off with the statistics. You gave us the statistics earlier, but you also mentioned that because of this kind of program, you are able to reduce those numbers. Can you just talk to us about how the numbers have been dropping?
Okay, when you look at the statistics of the past 5 years and the current of last statistics, there is a decline in numbers in terms of the learners who are still falling pregnant, meaning that it shows that what we are doing, it has an impact, a positive one, because the one child, if he's not falling pregnant, it's something that we need to appreciate and acknowledge, because we need to praise that child. Remember that these statistics were high because of they were lacking the knowledge. They needed the expert to come to them. They needed everyone to come to them. Remember that the teenage pregnancy is not only health related, it's everyone. From the household, as a parent, you are affected because of if this child fall pregnant, the unemployment rate is going to be high, the poverty will increase. Now, when you look at the society, some of them are falling from the statutory rape. Now they are not being reported, the child is suffering. And then when you look at the health, I already mentioned the health risks that they will be encountering. Education ones, in terms of advancing to the education, it's a minimal chances because of now it's a problem. So when you look at this reduction of the statistics that we see, it's something that we need to acknowledge and praise the young learners, and we need to continue. But there is a decline when you look at the statistics of 2023 and 2024 with the certain percentage.
Thank you so much for your time. Griselda, that was our health expert there focusing on school health services. That is Nolikula Mashinini, just talking to us about some of the issues that they encounter with young girls who fall pregnant, young girls who go to clinics. The department there also talking about the services that they provide to ensure that when these young people, whether girl or boy, go to the clinic, they have a safe space that they can go to, where they can meet a nurse who is properly trained to deal with their issues. With that, is back to you.
Kamogelo, thank you very much. Indeed, a very important conversation that you're having there. Kamogelo Seekoei speaking to us there, of course.